Chairman Gonzalez and members of the Small Business Committee, I'm Dennis Wiesner, a registered pharmacist, and I'm Senior Director of Privacy, Pharmacy, Regulatory, and Industry Affairs for H.E.B. Grocery Company, headquartered in San Antonio, Texas. I'm testifying today on behalf of the National Association of Chain Drugstores. Over half of the NACDS membership operates 20 or fewer stores. We appreciate this committee's support for pharmacies, particularly the leadership of Chairman Gonzalez, Chairwoman Velasquez, and Ranking Member Shabbat on the Medicaid AMP issue. As you may be aware, 20% of the Medicaid population is located in rural areas of the country, and in Texas, many of our stores are located in rural towns. For Medicaid beneficiaries, we are often the most accessible supplier of prescription medications, health information, and critical health care services. In particular, my company offers immunizations in all of our locations. Pharmacies are the face of neighborhood health care. It is with this in mind that I express my concern regarding the devastating cuts to Medicaid pharmacy reimbursement called for by the Deficit Reduction Act of 2005 and the CMS implementing regulations commonly referred to as the AMP rule. For many pharmacies, the AMP cuts to Medicaid reimbursement place our businesses at risk and threaten patients' access to medication. Many pharmacies will not survive the AMP cuts because they will be paid less for generic drugs than it costs to purchase them. Many pharmacies may have to cut back services or shorten their operating hours, and it has been estimated that as many as 12,000 pharmacies across the country could close their doors. If patients lose access to vital medications, it could also lead to more emergency room visits and expensive catastrophic care. Failure to take medications as prescribed is estimated to cost $177 billion annually. The AMP rule is fundamentally flawed in many ways, but in particular, it fails to provide a thorough analysis of the economic impact that this rule would have on small pharmacy businesses, as required under the Regulatory Flexibility Act. In light of numerous statutory violations, a federal judge has blocked implementation of the AMP cuts. However, only Congress can prevent these cuts with a permanent legislative fix. That is why it is essential that Congress pass the Fair Medicaid Drug Payment Act, House 3700 and Senate Bill 1951. I urge all members of the committee to co-sponsor this important bill. I would like to focus the rest of my statement on the Medicare program and the impact of related CMS regulations on beneficiary access to drugs, medical supplies, and services. When enacting the Medicare Modernization Act, Congress recognized the value and trust patients place in their local pharmacist and the need to preserve those relationships, many of which go beyond the simple filling of a prescription. Thus, Congress included a level playing field provision to ensure that patients can obtain their Part D benefits from any retail pharmacy of their choice. However, CMS's implementation and its guidance on how plans should follow this provision are inconsistent with congressional intent. As a result, Medicare plans are steering patients to mail-order houses and discouraging 90-day supplies at retail by offering lower reimbursement rates or by charging higher co-pays for the patients. These practices deny patients a choice in their health care provider. Another area of concern involves new program requirements and competitive bidding under the Medicare Part B for durable Medicare equipment and supplies, which will also harm patients' access to their local community pharmacist, the most readily accessible health care provider in the community. On this issue, NACDS proposes the following recommendations, on which I elaborate in my written statement. First, state-licensed retail pharmacies should be exempt from the accreditation requirement. State-licensed pharmacies are licensed by their respective state board of pharmacy and abide by strict state and federal laws, including those related to health care fraud and abuse. Next, diabetes testing supplies sold at retail pharmacies should not be subject to competitive bidding. Expansion of the program to include diabetic supplies sold at retail pharmacies could harm patients' access to those products and create a fragmented care in the management of diabetes. And last, CMS should not create national or regional competitive bidding areas for mail-order items. Mail-order program is likely to compromise on the quality of products and services, pose tremendous navigational obstacles to the low-income and minority beneficiaries, and could force patients to either forego diabetes testings or do it in an improper and limited manner. And this, of course, could have devastating effects. On behalf of my company, H.E.B. and NACDS, Mr. Chairman, thank you again for the opportunity to testify today before the committee, and I welcome any questions you may have.